Dealing with ulcerative colitis can be really tough, but there's some good news on the horizon with treatments like VELSIPITY hitting the scene. This new drug, freshly approved by the FDA, is making waves and giving folks with ulcerative colitis a reason to be hopeful again. So let's dive into the top 10 things you should know about VELSIPITY to get the full picture of what this medication is all about. Ulcerative colitis is basically when your immune system goes a bit haywire. Your immune cells, called lymphocytes, mistakenly attack the lining of your large intestine, thinking it's some sort of invader. This mistaken attack leads to inflammation, which can cause all sorts of uncomfortable symptoms like tummy pain, bleeding from the back passage, diarrhea, or feeling really tired. All these symptoms can really mess with a person's day-to-day life. So when it comes to ulcerative colitis, there are a bunch of symptoms you might run into. You could feel some cramps or pains in your belly, kind of like a tummy ache. Then there's the bathroom situation. You might find yourself making frequent trips, and the stool can be watery or even have blood or mucus in it. And speaking of blood, it can show up when you go to the bathroom, which can be pretty scary. Sometimes you might feel like you urgently need to go, even if there's not much to pass. On top of that, you might feel really tired or lacking in energy, almost like you're constantly running on low battery. Now let's talk more about VELSIPITY. Number 1. The name behind the drug. VELSIPITY's real name, like its official name you'd find on medical papers, is etrasimod. Now that name might sound a bit fancy or hard to remember, but knowing it is very important. This etrasimod stuff has been studied and crafted carefully by scientists to specifically tackle what's going wrong with people with ulcerative colitis. So it's the main ingredient doing the heavy lifting to help treat the condition. Number 2. The mechanism of action. VELSIPITY works by keeping those immune cells, called lymphocytes, from getting into the large intestine. Instead, it traps them in the lymph nodes. This helps stop the inflammation that causes problems in the colon and rectum. So by reducing this inflammation, VELSIPITY helps ease the symptoms of ulcerative colitis and can even put the disease into remission for some people. Number 3. It's a tablet, not a biological drug. VELSIPITY is a tablet you can swallow, which is pretty cool because a lot of treatments for ulcerative colitis usually involve getting injections or having infusions. So with VELSIPITY, you get to skip those needles and still get the treatment you need. It's more straightforward and less intrusive way to manage the condition. Number 4. Speedy symptom improvement. VELSIPITY works pretty fast, which is great news. In clinical trials, people started feeling better as soon as 2 weeks into treatment. This quick relief can be a big relief for people dealing with the ups and downs of ulcerative colitis symptoms. Number 5. Elevate UC52 trial success. The Elevate UC52 trial affirmed VELSIPITY's effectiveness in treating ulcerative colitis. The data indicated a 20% higher remission rate at week 12 and a 25% higher rate at week 52 compared to a placebo. This underscores VELSIPITY's potential as an effective treatment option. Number 6. Potential side effects. Using VELSIPITY can be really effective for managing ulcerative colitis symptoms. But like many meds, it can come with side effects. Some people might feel a bit dizzy, get headaches, or find out their liver tests are a bit high. Number 7. Serious side effects. On the more serious side, symptoms such as unexplained nausea, loss of appetite, yellowing of the skin or eyes, abdominal pain, dark-colored urine, or fatigue may indicate liver problems, while elevated blood pressure could lead to heart-related complications if left untreated. Macular edema, characterized by visual disturbances like blurriness, blind spots, or sensitivity to light, necessitates immediate attention to prevent irreversible vision damage. By staying vigilant and promptly consulting a healthcare provider about any concerning symptoms, individuals can effectively manage these potential risks and ensure the safest and most beneficial outcomes from VELSIPITY treatment. Number 8. Getting the most out of VELSIPITY. Taking VELSIPITY is simple and effective. It's a 2 mg tablet that you swallow once a day. Whether you're taking it with breakfast or an empty stomach, it's up to you. Just remember to follow your doctor's advice on how and when to take it. This helps ensure you're getting the most benefit from your treatment. Keep your VELSIPITY stored in a place where it's between 68 degrees Fahrenheit to 77 degrees Fahrenheit or 20 degrees Celsius to 25 degrees Celsius. The main active ingredient is called etrasimide arginine, and it's backed up by other ingredients like magnesium stearate, manganol, and microcrystalline cellulose. These help keep the tablet stable. Number 9. Who should think twice about VELSIPITY? Before you start taking VELSIPITY, it's important to let your doctor know about any health issues you have. This includes heart problems, liver troubles, or any ongoing infections. VELSIPITY can raise the risk of infection and might affect your heart rate or liver. Your doctor will keep an eye on things to make sure you're using VELSIPITY safely. Thinking about pregnancy or breastfeeding? If you're planning to have a baby or if you're breastfeeding, talk to your doctor first. VELSIPITY could potentially harm an unborn baby, so using reliable birth control during treatment is advised. Also, it's not clear how VELSIPITY might affect breast milk, so it's best to avoid breastfeeding while you're on this medication. Number 10. Watch out for drug interactions. VELSIPITY can interact with other medications, so it's really important to let your doctor know about everything you're taking. This includes prescriptions, over-the-counter meds, vitamins, and even herbal supplements. Some drugs, especially certain heart or immune system meds, can cause issues when taken with VELSIPITY. Your doctor will help you manage these interactions safely. VELSIPITY heralds a new era in ulcerative colitis treatment. With its distinctive mechanisms, proven efficacy, and convenient oral form, it brings hope to patients confronting this challenging condition. Nevertheless, VELSIPITY, like all medications, possess potential side effects and considerations that demand vigilant management. Maintaining open communication with your healthcare provider is key to maximizing benefits while minimizing risk. Hey, I'm Dr. B and welcome to my channel. Please check more of my videos about health and medications. And cheers to a healthy life.